Welcome back on the AM show, and as you can see in the background, it's all about the vaccine rollout. Shortly, we'll be connecting to the Malata clinic where Mama Viosu-Abuaje is together with the team. A lot going down there. Whatever questions you have, do pipe them through #AM show. Mama Viosu-Abuaje, if you can hear me, please take it away with regard to what we're coming through with at the Malata clinic.
Of educating, making noise, and encouraging people to go forward and take the jab. Thank you for being here as well.
Good morning.
Also, Mr. George Sabla is head of safety monitoring department, the Food and Drugs Authority. Good morning, and thank you for being here, George.
Thank you.
So I'd like to probably start with you. You've been monitoring, obviously, the vaccination exercise. So what are the concerns or the challenges that you're picking up from the ground?
Thank you very much, Mama V, and good morning to the viewers. I would like to start by telling you briefly about the system we have in place to monitor the safety of vaccines and other medicinal products. And I'll talk specifically about what we are doing about the COVID-19 vaccine deployment. Then I can go into the specific.
Okay, but can we clarify, are we still only using the AstraZeneca?
At the moment, yes, we are only using the AstraZeneca vaccine manufactured by Serum of India called Covishield. That's what we are using at the moment.
Okay.
For the deployment.
Is that the only approved vaccine?
The FDA approved 2 vaccines. The Covishield from Serum of India, that using the same technology from AstraZeneca, and also Sputnik V from Russia. So these are the 2 approved COVID-19 vaccines at the moment. But the Ghana Health Service is using only the Covishield from Serum of India. That's what they're using at the moment.
Is there a reason we haven't started using the Russian one yet?
At the moment, what is happening that the vaccines that the Ghana Health Service received came from the COVAX facility. I'm sure Dr. Achedu will talk about that in detail.
All right.
And that is what we are using now.
Okay.
So as and when the Ghana Health Service decide to get from other sources, maybe the Sputnik V will come into play.
Okay.
Yeah.
Okay, so go ahead and take us through the system that you've set up.
Okay, so first of all, I can say with all humility and without any fear of contradiction that the safety monitoring we have in place in Ghana to monitor the safety of vaccines and other medicine products is one of the best in the world. What am I saying this? Between 2019 and 2020, WHO reviewed our system for about 2 years, and they came to the conclusion that our system is operating at maturity level 4. Maturity level 4 simply means that the system is operating at an advanced level with only room for improvement. So our system can be compared to anywhere in this world. And then we've had experience in monitoring the safety of vaccines over the years. Ghana was the first country to introduce rotavirus vaccines and Mpox vaccine to an immunization program, and that was done effectively well. And currently, we are monitoring the safety of malaria vaccine that's been piloted in 7 regions in Ghana. We've done that for about 2 years without any safety concerns, and Ghana's data is coming out as one of the best compared to the 2 other African countries that are doing this. So we've had experience, and we are also RCOR. RCOR means we are regulatory center of excellence for other regulators. So we have other regulators coming to Ghana to benchmark with our system and learn what we are doing in Ghana. And specifically for COVID-19 vaccine deployment, what we are doing is that we have a proactive system to collect data from different sources. So the first system is that we do what we call the enhanced spontaneous reporting system. We already have a system where healthcare workers and patients can report side effects of their medicine and vaccine to the FDA. What we have done before the deployment is that we train health workers from the regional level to the facility level, and also volunteers who are given the vaccine, including people from NCC, on how to communicate and safety issues around the vaccine.
Okay.
So we more like improve the already existing system so that we can receive any safety issues from the deployment. The second source of data that we are collecting is that we are following up actively a group of people who received the vaccine, and we are doing this in 5 selected healthcare facilities in this country, in the Greater Accra region, in the Ashanti region and the Central region, where the deployment is currently ongoing. And what we do is that in case we don't receive reports from our spontaneous reporting system. We will get reports. So these people, we follow them actively. There are health workers that are trained in these centers to call them daily. If they call, they don't pick their phone. They go to their homes and find out if you have any adverse events or any side effect from the vaccine that is given to you. And the third source of our data is that the manufacturer is required by law to submit to us frequently the number of side effects that they have received all over the world. So the manufacturer of the vaccine we are using in Ghana, like I said, is Serums of India. So we received 4 reports from them so far, and they give us the number of doses that they have deployed all over the world, the number of side effects that they have received from all over the world.
Okay, so this is the Serum Institute in India?
Yes.
Okay.
So they submit, so these are the 4 sources of report we receive, and these reports are reviewed daily by a group of 12 scientists. Daily, to look at if there are any unusual side effects that are coming from the 3 sources that I already mentioned.
Okay.
And in addition to that, we don't rely on the scientists at the FDA. We have a group of independent experts that is made up of 12 independent experts that review the data. They meet every 2 weeks to look at the data that we are receiving from these 3 sources and advise the FDA on is the vaccine safe, the side effect too much, is the side effect more than the expected rate from the clinical trial that were reviewed by the FDA. So this is what we are doing currently to ensure the safety.
So this is great. Can we now go into the details? What's the Serum Institute, for instance, reporting in terms of the adverse effects? Okay.
Cumulatively, they have deployed close to 92 million doses all over the world. And they received, from the report we had from them, there were about 400 side effects.
400?
Yeah, 400.
Okay.
So what it means that there are about 400 people who reported side effects to the company who manufactured the vaccine from all over the world, from Bangladesh, from India, from Brazil, where the vaccine was deployed. And most of these side effects are things that we know of the vaccine. They are headaches, they are muscle aches, nausea, vomiting.
Does it include the blood clots?
There are 2 reports of blood clots from the company, but I think we can go into detail. There is something called background incidence of a disease. So the question is that would there have been blood clots if there was no vaccination? The answer is yes. So every case that is submitted is expected to be investigated. And we do the same thing in this country. We have a team of investigators in all the regions. So any serious event that is received, the team go and investigate this report. The team is made up of FDA and the Ghana Health Service employees, a team of 7 people who are trained to do this. So these 2 events that were received from the company, they were investigated by the Indian government. These 2 events came from India. They were investigated, and the conclusion is that these 2 events have nothing to do with the vaccine or the vaccination.
Okay. Let's come home. What have we picked from the monitoring? What are people reporting? Are there unusual reports?
Yeah. So just as I explained our safety monitoring system earlier on, so as at now, we receive about 1,400 reports from about 400,000 doses given. So, and these reports are generally minor events, headache, nausea, muscle ache, fever, pain at the injection site. These are expected from the vaccination. So these are the events that were reported to us. And the reporting rate, we were looking at, for every 1,000 people vaccinated, we are receiving about 3 reports. And that is very good because we're comparing with other countries that are deploying the same vaccines. And the reason why we are comparing the reporting rate is that we want to be sure if our system is working enough and it can pick up any new safety issues that were not picked up during the clinical trials. And that's why we are monitoring the safety of this vaccine. So we compare with the UK, we compare with Canada, we compare with Australia. And our reporting rate is one of the best. So if there are any safety issues with this vaccine, in this country, we should be able to pick it up.
Okay. Yeah. All right. That's good to know. That's quite extensive. If you've got questions based on what George has just explained, we would love to hear it as well. And as we have this interaction, remember that we're coming from the Malam Atta Clinic. And so we're showing you also scenes of persons who have boldly walked in to take their jab. Dr. Esiedu Bekwing, It is fantastic that they're taking the jab, but there's something that you need to do to prepare yourself for the vaccine. Am I right? Because I was told that you have to eat well. Drinking just tea and bread is not enough. I don't know if it's a myth or it's actually fact. And then after you've taken the jab, there are things also that you have to do. Is there some tips that you want to give us, especially those who are taking it?
Okay, thank you very much. So I think that you don't have any special ways of preparing yourself to take an injection, but because it's an injection, I mean, maybe it will be good that you eat. We are not saying go and eat any big food, but just something that you think that is okay for you. And then what I would say is that if you go through the process after taking the vaccine, we ask you to stay for some minutes so that we are able to be sure that you are fine after the process. So we don't have any particular ways that you need to prepare. What we want to say is that you don't need to take some particular medications before the vaccination. Somehow it can interfere with the immune response that we expect. So you just go your normal way to the place, and then you get your vaccine. And as has been said by George, there are very little adverse reactions or side effects that may occur. So if it occurs and is whatever it is, you can report to any health practitioner and to be taken care of. So far, I think that we've run almost 2 weeks. We think that things are going fine.
How much of the 600,000 have we used?
Okay, so as at let me say that the process it starts with registration, and then you do the vaccination itself, and then you are given the card. So when we started, we were a little bit of a challenge about getting the registration process done quite rapidly. So there's a bit of a slowdown. So what is happening is that as I speak now, as at 7 p.m. yesterday, we had vaccinated 449,171. But let me say that it's more, because there are some numbers that are yet to be inputted into the database. So roughly maybe having this about 470,000 done. And this is across the country. You know, we are looking at Greater Accra, then Ashanti, and a little bit of Central. So Greater Accra too has done 250,000, and then Ashanti region has done 187,000, and Central has done a little over 11,000. So if you look at about 600,000 doses, then I think that we are about getting to the latter part of it, because we have a wasted rate of 5%. So it means that we are expecting maximum 570,000. So now you are looking at just a little over 100,000 doses left.
Okay, so are you running out of the vaccines?
You know, if you look at the approach that we use, you know, initially you open up several vaccination sites, and then after the first week, we try to narrow down into a few selected sites. So as we are here, Malamata is one of the sites. So what we're doing is that after the first phase, which is after using the 600,000, we go into a second phase, which will involve vaccinating specifically health workers across the country. Our approach was to target what we call the hotspots. So that's why we narrowed down on Greater Accra and Ashanti and then Central region. So we focus on 43 districts. But in terms of disease incidence, the highest group at risk is health workers. So we'll go beyond just the hotspots to now focus on health workers. And we want to do that starting from tomorrow. So all health workers in the remaining 13 regions will be vaccinated from tomorrow.
Okay. Madam Afutu, let me ask, in terms of the role that you're playing in all this, help us understand, what's the NCCE doing?
Thank you very much, and good morning to your viewers. In fact, we are playing a critical role in ensuring that we get the message of vaccination across the country. But before we did that, we were trained by the Ghana Health Service, Ghana Medical Association, and the Health Promotion Units. They trained our regional directors head office directors and then the district directors, and actually all staff of NCC have been trained on what the vaccine is, information about the vaccine, events to expect when you undertake the vaccine, and the processes of vaccine development, the benefit of vaccine, and other areas around the vaccines. So after the training, we also launch out to the field to ensure that we get the messages across to all Ghanaians to understand so that they can avail themselves to get vaccinated. But I must say that initially there was a bit of hesitancy because of myths that preceded the education. But I must say that now people understand the need to get the vaccine so that we can all help to fight the coronavirus. And people are ready, even in the regions where we haven't been yet, the 13 regions, people are ready to avail themselves when the vaccines are available. And even in the 3 endemic spots, that's the Greater Accra, Ashanti, and then the Ewutu Senya East and West. We had some of the places, Ewutu Senya East, like the Kaswa, I think they ran out of the vaccine. They had to call for some from the West and other areas. And we have information from the field where some churches are even ready to get their members vaccinated and all that. So I must say the sensitization has gone down well with Ghanaians. But as you expect, certainly we won't get everybody having to understand. So all that minority group will continue to engage to ensure that we get the messages across, because this is a pandemic that we are all fighting globally and even as a nation. So we are trying to get Ghanaians to help get the vaccine so that we can break the chain of spread and help contain the disease. And we're also telling them about the need to get vaccinated because it has a lot of benefits. Currently, some businesses have been closed down and all that due to COVID, that we need to observe the protocol. So if all of us help to ensure that we bring down the rate of infection and spread and death and all that, I mean, we all go about our normal duties. And our culture of making sure that we greet, we hug and all that, we can, life can return to normalcy. And it will depend on each and every Ghanaian. So we are leaving no stone unturned to ensure that we get to the nook and cranny of the country with the messages we received. And I think it has been, reception has been very high.
Great. So let me ask, George, have you taken your jab?
Yes, I did.
Auntie Joyce?
Yes, so I'll take it today.
You take it today?
Because we are arranging to have it at the head office so that we can get all staff vaccinated. But they haven't come yet, so I'll do that today right after.
Okay.
Yes, but we have some of the staff who have done it. And as they go around with the sensitization, some of them showed their card to encourage Ghanaians that no, we are not just asking people to vaccinate, but a lot of the staff have vaccinated and they are going about that.
That's actually okay.
Yeah, I took mine on the 2nd.
On the 2nd of March. Okay. I also took my, what's the dates that, I think 2 weeks ago, on the Friday, the 5th of March. I did because you put me in a certain category. So, so I got it. But did you have any adverse effects, George?
No, I did not have any adverse effects. I keep telling people, it was like I didn't receive any vaccine. It's only when I, because I start to feel, okay, let me touch here and see if there's any pain. A little pain here, and after today is gone. So I didn't have any adverse effects, no.
The headaches, did you feel dizzy? Fever?
I in particular didn't get anything, but I know a few friends who had a few side effects, general bodily pains, malaise, headache. But I think I'm fine. I'm lucky. I didn't get anything apart from the pain at the site of the injection.
Okay, I guess my story is just like yours, but there are other people who reports of other things, and sometimes the narration is a bit scary. So I've got to ask you, how long does it take to recover? Because if you feel something, and some people do feel something, how long would it take?
No, I think that basically depends on the individual. So we have individual idiosyncrasies, but normally most adverse events or side effects will resolve after 48 hours. But as maybe as George will tell you, there are a few that may have serious events that may occur. But typically, the common ones are the fever, the headache, the malaise. After 48 hours, you should be fine.
Is there a fear, though, because we know that some European countries, and these are big countries, there's France, there's Germany, there's Italy, who are holding on because of the issues of the blood clots, even though there's no direct link to the vaccine and the blood clots issue. Hopefully the European Medicine Agency will come up with their report later today, and that will clarify the matters. Do you see that because of what we're hearing from Europe, people are being hesitant, George?
At the moment, there is no evidence to that effect that people are holding back because of the news from Europe. What we've done is that about 2 days ago, the FDA issued a press release. I mentioned earlier on that we have a committee of experts, 11 members. I can say that is the best of the best brain in this country that we've put together to review safety information from this deployment. And the committee met and reviewed the data that we've had in Ghana about the 1,400 report that we received from the deployment. And then they also reviewed the report from Europe. And the conclusion was that at the time that they had a meeting, there was no evidence to stop the vaccination because the benefits of vaccinations outweigh the risk, and there was no evidence, there was no causal relationship between the blood clots and the vaccine. So that was the conclusion of the committee. And that was upheld later by UK. The UK had given the largest number of AstraZeneca vaccine. They've given about 10 million doses as of today, and they are still giving it. So, and then India, like I said, the producers of the vaccine we are using, they've deployed more than 90 million doses all over the world, more than 40 million doses used in India. They are still using the vaccine. So the issue in Europe is not a major concern. And if you permit me to say that, I mentioned earlier on there is a background incidence of a disease. For instance, in the population without vaccination, would there be blood clots? The answer is yes, there will be blood clots. So when the European medicine came out, when the countries in Europe came out with this fact that there is some link, or there is the fact that people took the vaccine and they had blood clots. What are events? What we are discussing, anytime we receive a vaccine, whatever happened to you, whether there's a link between the events and the vaccination, you have to report it. So the blood clots, there may not be any link until they do what we call causality assessments to verify that there's a link between the event and the vaccination. Now, all the countries in Europe that had temporarily suspended vaccination, what they are saying is that, okay, the background rate of blood clots is lower in people who are receiving the vaccine compared to the general population without a vaccination. So as of now, there were about 22 blood clots in about 70 million people vaccinated in Europe and the UK. And they are telling us that without a vaccination, the rate of blood clots is about 1 in 1,000 persons per year. So if you look at the rates are far, far lower in the vaccinated group than the general population. So there is actually no causal link between the blood clots and the vaccination. So like you said, the Europe, the PRAC, that's the Pharmacovigilance and Risk Assessment Group, will today issue a statement as to whether there is any causal link. But like I said, our committee has looked at it, and as of today, there is no evidence that the blood clot, there's any link between the blood clots and the vaccination.
And as I said from the beginning of this conversation, there's overabundance of information, and some of these information could be false or true, and that's why it's crucial that we have conversations like the one that we're having. We're coming to you live from the Malam Atta Clinic. And you can reach us with your questions. Just get onto the Joy News Facebook page and post your questions there. You could direct your questions to the Ghana Health Service, to the NCCE, to the FDA. I'll put it across so that they can address it. But Dr. Siedebekwin, do you have concerns with what I raised with George in terms of the blood clots? Is that making the work a lot more difficult?
Thank you very much. Apparently, I would say that a few days ago, we were kind of concerned because it was visibly true. But after a few other days, we realized that, there's a lot of politics in terms of medicines and vaccines. So the idea is that, is there the evidence? Clearly, as we speak now, there is no evidence of causality. that you take the vaccine, there's a high likelihood that you're going to get any blood clots. And you see, what has been analyzed is that they try to look at the incidence of blood clots in persons who have not been vaccinated and then those who have been vaccinated. And clearly there's no increasing evidence that when you vaccinate, you are likely to get blood clots. So I think that for now, it's not deterring the Ghanaians. And if you look at we as a service, I think our concern is making sure that we get enough vaccines, because we don't want to exhaust this 600,000 and then we're going to have a lack of no vaccines. So we think that, as was said by the Futu, the idea is gradually we are trying to overcome this vaccine hesitancy thing. So for us, for now, we are not very much concerned about the report of clots. What we are concerned about is making sure that we have enough vaccines for the Ghanaians to be vaccinated.
And Madam Futu, is this also hampering your efforts at getting people educated in terms of what Europe is reporting?
Yes, it's a new thing that has come. So we also have a bit of challenge. But what we keep telling them is that it hasn't been established whether it's linked to the vaccines. And if you look at the sensitization activities, that's why the health professionals, they are saying that it's adverse events, not effects actually, because it cannot be linked to the vaccine. Not every problem that you have is linked to the vaccine. And this one, it hasn't been established. So that is what we have also been telling the public. So after the statement that will be issued this afternoon, then we'll also ensure that we take that on board and get people to understand that it has no relation with the vaccine at all. And for that matter, we need to prepare ourselves and get vaccinated when it's available.
Okay. Dr. Sedi, is there a reason we're not using the vaccines from Russia yet, even though the FDA has approved?
Yes, so the reason is that we need numbers. You see, we need to get a good plan, and it's about numbers. So we have, for now, FDA has registered AstraZeneca as Sputnik, but we haven't gotten the numbers of Sputnik for us to get a clear plan. So
when you say the numbers of the Sputnik, what do you mean?
No, so let's say we want, our plan for the country is we want to vaccinate 20 million Ghanaians.
20 million.
And so if you have, let's say, 10,000, I mean, how are you going to distribute it? It's too minute number. So that's why we are expecting to get some large numbers of the Sputnik in the next few days or a week. And then we'll now see how to roll it out. So for now, it's about the numbers. That's why we have not started using the Sputnik. Clearly, it has been registered, so it's safe for use in Ghana. So all we are waiting for is to get the right. Let me say that for now, if you look at our plan, we are expecting to get, let's say, over 2 million doses of the COVAX vaccines. So then in that case, we're going to see how best to get it done.
Sorry, is Sputnik part of the COVAX vaccine?
No, for now it's not part. So, but it's registered and it's for use. And clearly, if you look at the literature from the Lancet journal, it's highly rated vaccine. So it's fit for purpose. What we are looking for is the numbers. And let me say that, if you look at our original plan, it was looking at segmented populations. So we are saying that we want people, health workers, people 60 years and above, people with underlying conditions. That was our original drive. When we started the exercise, initially there was a kind of laxity among Ghanaians, so there was kind of hesitancy. So we kind of relaxed it a bit to ensure that the average Ghanaian can actually testify that the vaccine is safe.
So that's why you allowed persons like myself
to
go forward and do it.
So that's one. But they also had what they call the influencers, the media. There are people who can actually set the agenda that the vaccines are safe. So, but if you look at the data they have collected, clearly we are still being able to achieve our critical persons for a start. So a substantial number of health workers have been vaccinated, people 60 years and above have been vaccinated, people with underlying conditions have been vaccinated. So clearly we are on course, though we have a reasonable number of population also being vaccinated. And I think it's good.
All right. I'll come back with the model that the UK is using and how different ours is from what they're doing. But I want to cross over still from the Malamata clinic to my colleague, Manuel Cranting, who's roving. He's going to be engaging some persons who have come in to take their jab. So over to you, Manuel.
Yes, Mama V. So indeed, you remember that most of the people, in fact, some of the people who have taken the jabs have been, when we've seen on social media reactions of some pains, headache, and so on and so forth. So, I mean, we've heard Dr. Franklin Isidu-Beking explain from the policy point, but on the ground, the folks who are, administering the jabs themselves, what is the procedure like? Let me talk to Catherine Asari. She's the head of disease control, disease surveillance in the Ayawaso Central Municipality. Grateful that you could speak to us. So tell us, what really is the picture like when, for instance, I as Manuel come here to get vaccinated?
Oh, okay. Good morning. Actually, when you come to be vaccinated, the first thing we will inquire is any ID. That doesn't mean that if you don't have any ID, we won't be vaccinated. You will still be vaccinated. So we take your ID, then we take your particulars, your date of birth, your names, because we have to capture them into the system. So whilst we are inquiring from your information, after taking everything, we enter into a platform that we are using to capture the data. After capturing all your information, you move to the site where you'll be vaccinated. So for the vaccination, we are vaccinating. The site is the left upper arm, and then it's intramuscular. So then,
what does that mean?
The needle should go 90% into 90 degrees, into the muscles. It should go straight. So
is that a reason we have pains in the muscle? Because we've had some medical experts explain that the reason for the pain is how the muscle is breached. Is that the reason?
I can say yes, but whichever way there will be pain, whichever angle that the vaccine is introduced, because we are just introducing a foreign body, we are just breaking through the muscle, so still there will be pain.
So technically, it's like getting a small sore on your skin, but this time around in the muscle.
Yes, please.
Okay, so that would explain the reason you have this. So I'll come back to you. So she says that we take vitals and all that, but and this is Joseph Intifo, is one of the officers here. I mean, what is the use of taking all the data that you are taking? A few of the reaction that we've seen on social media is people say that we're going to use this data to provide passport, and if you don't take the vaccine, you cannot access healthcare, you cannot go to market and shop, you cannot go have access to public services and so on. What really is the reason you are taking the data?
Good morning to our cherished listeners. I will start your question by the data in health sector. No matter where you will find yourself, whether OPD service or whatever, you have to get your data. So the same procedure that we are using, but this time around, we are not using paper, we are going paperless. So we are in technological era. So we have to capture your data for future reference. That's why we are taking your particulars.
Has it got anything to do with the second shot? Because we know with the AstraZeneca jabs, there are two, the first shot and the second shot. Data you are collecting, has it got anything to do with the second shot?
Yes. They have designed the system in such a way that if I can open it, you will see that you have a section under the forms which shows the first dose, second dose. So they have provided a column in the tablet so that shows that yes. So
if I take my first shot today, when am I supposed to come for the second?
8 weeks interval.
8 weeks interval.
Yes, please. So currently, if you are taking it today, your next shot will be on the 13th of May. Yeah.
I'll come back to you, Joseph, and let me speak to this lady here. She just took her jab. Pacho, feel fine.
That's fine.
Ebanese na obai. Ote vaccination ho sem finfa.
Oh, me pacho, lady ka me tie fu nyina. Ne mte ane say yes, yare bia by friend coronavirus. But so bia nhwe ne ho yi. ma umpie ma nante basa nti no ndie enwan say ye shefi ndie pie pa de mimpie bi akire na mete say aban de enro we yaba say ye mewo eni nti na ma me ba ya ba bewo
Ote radio and ote TV.
Na me de bia me she mimpie nti me TV ho nti me hu TV so
na we yesel be ba na wonsuro
there be minsuro because ansana aban di kan ya woni de enye hu.
So you heard her explain to me how she got to know about the jab. She says that she's restricted herself not to move out of her house because of fear of contracting the virus. And indeed, she's been watching TV and listening to radio. That's how come she got the information that there was a vaccination program actually ongoing. She decided to come. I asked the follow-up if she wasn't scared, given the the issues that are going around about headaches and so on. Then I'll be catching it a form of na omumbe woy na omusuru se ombe wa bibi yomo.
Me catch a phone etifu nyina se oma ye tintin so omeme wo no obia mra no mewo because yare no ewo ho ekum ni papa nti obia mra no mewo obewo bibia anyo me wo ye na anya me hwe nti no obia mra no mra mewo me medi 55.
So she's a 55-year-old lady. She just took the jab, and she's encouraging everyone who is, adamant, in fact, having skepticism to come out and take the jab because really there's nothing to be scared about. I'll wrap it all up with Kate finally and get Kate to tell us what a few of the things that they've heard. So as you're vaccinating, do people come back to you with complaints of headaches and those side effects?
Yeah, they do come. As at now, we have listed 11 AEFIs, and about 5 of them reported to the facility for management.
5. How many have you vaccinated so far? We started on 2nd March.
As at yesterday, the municipality have vaccinated 6,481, and then 5 of them came to the facility complaining of AEFI. So the 5 of them, further investigations were made. 2 of them were malaria. 1 man was hypertensive and has defaulted for the past 3 months, not taking the medication. So we just put him back on medication. The other one was muscle pains. So after investigations, she said we got to know that it's nothing serious. So we don't have any serious AEFI, but the normal one that has been listed out there that we've been.
In excess of 6,000 people have been vaccinated in the Ayawaso municipality, Ayawaso Central municipality. Just 5 people reported with reactions, and out of the 5, 2 of them had nothing to do with the vaccine, and just 1 or 2 people. That should give a picture of confidence in the vaccine, no?
Actually, those that reported were 11. And then 5 of them reported to the facility for management. That's where further investigations were made to know actually the cause of whatever they were feeling as at that time.
So it's been pretty smooth here at the Ayawaso Central Municipality. So you're hearing, there's just a brief interaction I've been having with the vaccinators here at the Malamata clinic, and essentially a really good picture of not so many side effects. Out of in excess of 6,000 people and over, just 11 people reported with side effects, and out of the 11, 5 were investigated, show that just 2 had anything to do with the vaccine, which of course has to do with the muscle pain, which is the breaching of the muscle. We are told at 90 degrees. And so if you're out there and you have not taken your jabs yet, perhaps this is a cue to you to go out and get vaccinated against COVID-19. Mamavi, I think we can hand over back to you now.
Yeah, thanks a lot, Manuel. I've seen 3 gentlemen walk in whilst you were having that conversation. I don't know if the Ghana Health Service, Dr. Asiedu Bekin, you have a good breakdown of in terms of data, who is taking the jab, how old are they, and whether they're male or female. I'll give you some time to pull that out if you do have it. But I have just visited the Ghana Health Service website, and this is the data as they have it today on the website. Again, I also don't know if there's an update that you want to help us with, but 705 persons have died from COVID-19. There are 47 persons who are in severe conditions and 18 in critical condition as well. Active cases 3,621. The figures are dropping, even though the death, the figures in terms of those who have died keep rising. What is happening? How do you break down this kind of data, Dr. Siri Bakwe?
Okay, so I don't know which one. Should I talk about the vaccine data or this one?
No, let's talk about this one.
Okay, so if you look at the data in Ghana, you know, our biggest hotspots are Greater Accra and Ashanti. What is happening is that the incidence of the cases in Greater Accra and Ashanti are actually dropping, and that's how it's actually affecting the national figure. But we can see that there are certain regions that appears to be getting more cases. So like Upper East, Volta.
Upper East and Volta?
Yes, Volta.
Okay.
Particularly Upper East is coming down, but Volta is seeing some reasonable number of cases. So that is, so though globally, like as a national database, they are going down. There are one or two regions that are going up. But in terms of the deaths, you see what is happening is that it's actually more of what they call batch reporting. You see, unlike the case report, which is on a daily basis, the deaths is based on as they are collected. So it is not. So what we are coming clear is to be clear about the date of death. This is the date of report. So for epidemiological purposes, the best indicator is the date of death. So it is not that so many people are dying; it's the way it's being reported. So if you look at the holistic view of the several situations in the country, you can see there's an improvement. About a few weeks ago, we went as high as 8,000 active cases. Now we are less than 4,000. Even our daily report of cases is even, I would say, less than 300. It used to be about 800. And the number of cases that are on admission has actually dropped from over 300 to now a little over less than 200. So in global terms, there's an improvement. And even if you look at our isolation place in PCC, the Kaswa place, now you go there and there are less than about 30 people there. So generally, there's an improvement in the situation, though I would say there are some regions that are getting cases. And we think that it has to do with people who move down to these areas. And because these regions are kind of naive in the sense that they have not been exposed. So when somebody goes and introduces the virus, and then in such instances, they are not adhering to protocols. Because there are areas that do not have the virus, so there's nothing like wearing of the mask. So if you get one virus introduced in such a community, then you have a big problem. So that is the issue. That's why we are trying to make sure that all regions are fully on board and fully embracing the use of the protocols.
Okay, now we can go to the vaccine data.
Yes, so the vaccine data, as at 7 p.m. on the 17th, as I said, we had vaccinated 449,171 persons, and the Ashanti had actually had 187,510. Central had 11,293. Greater Accra has 250,368. Then let's go to the categories. You see, we are actually doing the segmented approach. But as I said, I tried to explain, because of issue about vaccine hesitancy, we didn't wholly go by it. So let's see how many people have been vaccinated.
Okay.
For now, yes. So the highest is people 60 years and above.
Okay.
So that one we have is 99,305. Then we have the general population, that's people 18 years and above. They are 87,092. You have health workers. You have 72,332. Then we have people with underlying conditions. You have 63,033, and it goes down. And let me see the media. Media is 3,063. They have teachers 18,000. So clearly, if you look at our segmented population, we think that our critical ones are captured. What is coming in as a supposed outsider is the population, the general population.
Okay.
But we think that is good for us. It help us to address the vaccine hesitancy, because they can go to their friends and relatives and tell them that the vaccine is safe and it works.
Okay. So have you achieved your targets in terms of what you set out to do in the first 2 weeks?
Yes. I think that we are. If you want to look at it in terms of coverages, I think we are about 80%. And as I said, we have not fully entered the data. So I think that's what we wanted to achieve. We are clearly on course, and we are hoping to get more than 500,000 people vaccinated at the end of the exercise.
Okay. Well, there are some questions that I still want to ask, but just to remind our viewers, if you've just tuned in and you're watching, you're wondering what's happening, I'm sure you've heard vaccine. Yes, it's a series of vaccination conversations that we're having, so you can clarify certain things in your mind as you get ready to get out there to go and get your jab. We call it the COVID-19 vaccine conversations, the rollout stories and lessons. And my guest from the Ghana Health Service, from the NCCE and from the FDA, we're coming to you from the Malam Atta Market. And my colleague Manuel Kranting is also here. He is roving and talking to persons who have visited the facility to take their vaccinations. So I want to engage George now. I wanted to put this question to Dr. Siedu Bekwing, but I probably would start with you. What's the difference between what the UK is doing and what Ghana is doing? So I have cousins, for instance, who would say they haven't been given the notification to go out there and take the jab. They're concentrating on a certain group. What are we doing? Or maybe I should get Dr. Bekwing to answer.
So I think that you see, basically what the vaccination does is, one, you want to reduce infection, and two, minimize severity of infection and possible death. So you ask yourself, which people in the general population are we likely to be infected? Which people are you likely to have severe disease and maybe die? So that's why all over the world, the first group is health workers. So every country, they have first group because they are the people who are likely to be infected. And also when they are infected, it has effect on the general population. So every country is trying to vaccinate the health workers. What Ghana has done is that Ghana, we have 4 groups. So we have the first group, which is health workers. They have the people, Ghana, we have a very youthful population. So we are saying our age is 60 and above. Other countries is 85 and things like that. In the UK, I think that's what they are using. And then we also have people with underlying conditions, because they are people likely to die or have severe disease. So that's in our first group. But we have gone ahead to say that we need to, Ghana must rule. So we need to have the arms of government also as part. And then the frontline security services. So this consists of our first group in Ghana. Our second group is the people in the essential services, water, telecommunication, and those are the people for the second group. Then the third group is the general population who are 18 years and above. And we have fourth group, which for now there's no vaccine for, because the vaccines available are for people 18 years and above. So globally, that group, there's no vaccine for it now. So, and because our system is purely based on segmentation and based on hotspot, so we are saying that when you are in Accra and you are in Kumasi, part of Kumasi or part of Central Region, you are a priority group. And we are not, for now, we are not using appointments. or we are no use appointment. So we encourage people to come so far as you are in that vicinity. But going forward, we are trying to introduce an app that will help us to pre-register and have appointment.
Okay.
So that it will be well structured. And as I said, we will be able to do more of this when we have a reasonable number of vaccines. So for places like the UK and the US, they have been able to clearly categorize the population into the groups. And then they are able to place it by appointments and say that you are in Sussex, this part. So you are supposed to come at this time. So as I said, going forward, we will also be getting closer to what is being done. But because of the limited number of vaccines, they are yet to fully do what they are doing. But technically, it's about the same thing. It's about who's more at risk and who's more likely to die and who to come early. I mean, so that's what is being done across the world.
Okay. So, Madam Afutu, how are you sending the message?
So we are using different strategies. We are communicating to the people through one-on-one. We are going.
You're doing one-on-one.
Yes.
So you're doing
it's also
door to
one
door.
strategy. Yes.
Okay.
No, we are going to identifiable groups. Even currently, nationally, we are also doing identifiable groups, the focus group. Even tomorrow, we have an engagement with the market women. Different markets, we are bringing them together. That's why we call it focus, because when they also go, they have to also go and train their members. And we'll be meeting the security services and other groups, NAT and all of them. We meet the leadership and they also go and train. So we are using that as one of the strategies. We are also, this platform is also another. Our media engagement, and at the national, regional, and district level. And at the district level, a lot of people are using community information centers and community radios. We are also doing street announcements, where we have the jingle from the vaccine Ghana Health Service, and then we play the jingle, we do whistle stops, and then people come to ask questions, and then we also educate in that direction. We are also meeting people in churches, in mosques, in markets, wherever we can find people, we are doing that. And we are also reaching out to people on social media. We have Facebook, NCCGH. We have our Instagram, NCCGH1, and then Twitter at NCCGH. We are also reaching Ghanaians using that platform as well. So we are doing a mixed means of communication to reach out to the people of Ghana.
If you had more resources, i.e. money, vehicles, etc., what do you think you could have done more in addition to what you've just mentioned to us?
Yes, in addition, we would have intensified the activities, because if every district has a vehicle and we just record the messages, we just move around and we just get around and engage one-on-one, door-to-door and all that. So currently, some don't have vehicles, some also have motorbikes, and some have vehicles, so we are going around doing what is needed. So that is what we are doing currently. So if we get more support, we'll intensify our activities. But notwithstanding, we are engaging Ghanaians to ensure that we get every person in every hamlet across the country to get him or herself readiness. So that when he gets to their turn, they can get and then come and get vaccinated.
The Commission's work is crucial to what the FDA does. Shouldn't the FDA be reaching out and handing over some of your resources to the Commission? I guess that's another conversation. I'm not going to put you on the spot. But in terms of when people record some of these side effects, what kind of help do you give them? Because you've asked us to let you know, the FDA. So what kind of help do you give?
What we do is that every report we receive, we follow up on the one we reported. We have several means of reporting. We have an online platform that you can report. We have a mobile app that you can report. And if you look at your card, there's a telephone number at the back of the card, 0244-310. That number, you can call that number. That's a call center that people are receiving that call 24 hours a day. And then we have an online portal through which you can you can report side effects to the FDA. So every reporter is followed up. We send an email to you. We call you to find out how you're doing, if you recovered. And if you have a serious adverse event, serious means if there's a disability, if you end up at the hospital, and then you have to receive treatment, and in an unfortunate case of death, This, if you have to receive treatment, the treatment is free, and that is done in collaboration with Ghana Health Service. So every Ghana Health Service facility that you go to with a serious adverse event that must be treated is done for free, and Ghana Health Service take up the cost.
Have you recorded incidents like that?
We, at the moment, we receive, out of the 1,500 events that we received, there were just about 5 that were serious. And these people...
So they went through hospitalization?
Yes, please. And some were detained for a few hours and discharged. So basically, these are the serious events that we've had. And
you say that if that unfortunate incident should happen to you, you're not paying the bill. The Ghana Health Service is footing the bill.
Yeah, Ghana Health Service. Because we are doing this in collaboration with Ghana Health Service. So Ghana Health Service foot the bill of the treatments for the adverse event.
Do we know the status of the 5? What's the condition of the 5 now?
They have recovered, yes.
Okay, so there's no person in the hospital now?
As with the 5 that we received, there's no person at the hospital now.
Okay.
Maybe if there's one as of today, I do not have that detail.
Okay. Yes. So Ghana Health says, Dr. Esiedebekun, do you have cases of people who have been hospitalized because of the effects that the vaccine has had on them?
I think, but let me say that it's not only COVID that we do AEFIs. I mean, for all vaccines that have been used over the country, if you have any serious adverse events, you go to the hospital and it's treated free of charge.
Okay.
So as has been said by George, for now we don't have any record of anybody on admission, but this is an evolving situation, so it can change. But as of now, we don't have any record of that.
Okay. I just also want to say that this conversation is brought to you by the Multimedia Group in partnership with Star Ghana Foundation, UK Aid, and the FCDO. So on to some questions now. This one says, good morning. I want to know how an individual gets to know he or she has blood clot issues to report to authorities and what prompts health authorities to suspect blood clots in individuals.
Yeah, so basically it depends on the presentation. So you have a common one called DVT. That's a deep vein thrombosis. So you may have part of your, normally is your leg. And you may realize that you have pain or tenderness and you have swelling at that part of your leg. It could be at your calf, it could be even at your what you call popliteal area, behind your knee, or maybe even be higher up. Okay. So you have severe pain there, and then it may even be hot, and your leg will be swollen. Then let's say if you have severe one, it may enter your lung and it may affect your breathing. So those are the signs of the thrombosis or the embolism that may occur. So in that case, it becomes a serious event that you cannot afford to stay at home. You need to go to hospital, and they need to do a lot of investigations, X-ray, Doppler, that you can actually find. So clearly now.
And how long does it last after getting the COVID-19 vaccine?
Apparently, the available literature is saying that you start getting the immunity after like 2 weeks, but the duration or the extent is not very certain yet. You know, these are new vaccines that are still being studied. So for now, they are not very sure whether when you take the AstraZeneca, it will be immunized for 2 years or 3 years. But what I want to say is that it's an aggregation of your immunity. So if you get the first dose, get some level of immunity, and then get the second one, that's how you can start assessing your degree of immunity. So you cannot just take one dose and decide you want to take the second dose.
So do I have a certain amount of immunity now with the first jab?
Yes, you have. But then when you get the second one, that is added on, that you can be sure of that level of efficacy of the vaccine. So you cannot just take one and stay.
Okay. Can I still catch COVID-19 and infect others?
When?
Can I, as in, if you've taken the vaccine, can you still get COVID-19?
No, I think that it depends on the stage. You see, normally you get immunized, let's say, after 2 weeks. So let's say if you have been exposed and within the first 2 weeks, then you can get the infection and then you can infect others. But typically, when you have gotten, let's say, the 2 doses of AstraZeneca, then it gives you some level of immunity that prevents you from getting the degree of infection for you to infect others.
Okay. All right. Here's another question. This person says, I took mine yesterday. I took paracetamol 45 minutes prior to the injection and 8 hours after injection. The only pain I feel is just at the yourself. Thank you for the feedback. This one says, I had my vaccination on Friday and it's the worst thing that has ever happened to me. Till today, I still have the side effects and it's not getting better at all. Never will I go for the second vaccination. Okay, so this person feels strongly. He says, no way. But if you are still watching, and I know that you're still watching, kindly send us exactly what is happening to you in terms of how you're feeling. This one also says, have the vaccination started for the under 30s? And again, you're saying we're not categorizing in that sense.
No, you see, as I said, our segmentation typically is for people 60 years and above, and then people who have underlying conditions, and then health workers. So there are some targeted groups for now. But because there was this issue about hesitancy, we kind of relax it a bit. But I think that it is good for us to be clear in our mind that this first phase is for some certain category of persons.
Okay.
So it would be good that, let's say, you allow a 65-year-old person to get a vaccine than a 30-year-old person.
Okay.
I mean, in terms of outcomes. Okay. So, I mean, we encourage Ghanaians to take it, but let's try and make sure that those who are more at risk get it earlier than you.
Okay. This one.
But there are some group who get the infection and come out with severe disease, and realize that they are people who have conditions like hypertension, diabetes, even cancer. They have some level of lowered immunity. So when they get the infection, they get severe disease. So those are a prioritized group that we try to make sure they are vaccinated and then we don't get bad outcomes.
Okay. All right. This conversation, our COVID-19 vaccine conversations, the rollout stories and lessons will be coming to a close in a little bit, but it's brought to you by the Multimedia Group in partnership with Star Ghana Foundation, UK Aid, and the FCDO. The Ghana Health Service, the NCCE, and the FDA are my guests this morning here on the show. We're coming to you from the Malamata Clinic, and we also have persons who are taking their jab. And I guess Dr. Siedo Bekwin will be happy because most of the people we've seen walking are elderly. At least we can say for setting that they're about 50, which is the target that you want to hit. But to go back on the 30th of April to take the booster.
Second dose.
Okay. Would I be sure that you have my vaccine?
Oh yes. So if you look at the country's plan, we are expecting a reasonable number of doses of AstraZeneca and possibly Sputnik in the next few weeks to come. What we see, if you look at the regimen of the AstraZeneca, you want to do first dose and then repeat after 8 weeks. But then even there's a space up to 4 weeks. So the time you're supposed to take yours is 8 to 12 weeks. But we are expecting over 2 million doses of AstraZeneca the next, let's say, 4 weeks to 5 weeks. So by that time, yours is due and mine will be due. There will be a reasonable number of AstraZeneca. And then we are also procuring the Sputnik V. I want to say that for now, we are not combining two separate vaccines. So we cannot take AstraZeneca and go to Sputnik. But it's early days yet. There's a lot of study being done whether you can do interchangeable vaccines. But for now, it's not like that. So you take AstraZeneca, you repeat with AstraZeneca. You take Sputnik, you repeat with Sputnik. So don't be much allayed. You get the vaccines when it's time.
Okay. What happens if I lose my card?
Yeah, so you see, that's why the registration is done. So all your personal information is on it. They even took your email address, your phone address. So when it's time, you'll be called and notified that it's time to come for your second dose.
Okay. All right. So even if I lose it, is there a reason?
Side effects or adverse events that may occur. You want to know, if you look at even what is happening in Europe, there are some instances that they withdraw some batch numbers. They are not saying the whole vaccine. So is it possible that there's a problem with some batch numbers? So that's what they record for you to be recalled when there's a problem.
Okay. So George, and in ending the conversation, I'd like you to tell us again why the FDA is not recommending that we pause this vaccination. Just like what some European countries have done. and we're going on. We're actually asking people to still come forward and do this.
Yeah, so what I want to say is that I explained to the viewers that the FDA, Ghana has one of the best systems in the world for safety monitoring of vaccines and other medicinal products. If there are any safety issues from this deployment, we will pick it up. Because I also explained that the event that we are receiving from this deployment is similar to what, or even better than what other countries in Europe and in Canada are receiving. So the point is that we have the best system to monitor the safety of these vaccines. And number two, as at Friday last week, our committee of experts, the 11 committee, the joint COVID-19 Vaccine Safety Review Committee, look at all the report that we have received as having COVID-19 infection. So I want to assure Ghanaians that Ghana is one of the best when it comes to safety monitoring of vaccines. At this point in time, the vaccines are safe. There's no safety concern, so people should go for their jobs because the vaccine protects you. It protects you against having severe disease. It protects you from hospitalization and death from COVID-19 infection. And in case the gentleman who sent a message that he has the worst event is still watching, I would like to encourage him to look at the number, the 024 number on the card.
Okay. Is it the same number?
Yes.
Okay, so I guess I can go over what is here. 0244 310 297. 0244 310 297. That's the number to you.
Yes.
Okay.
So can call this number or download the app and reports, and we'll follow up. The reason is that we are interested in every single case or every single event that happened to any vaccine recipient, and that's the way that we can continue to say with confidence that the vaccine is safe. Because if nobody is reporting, we cannot continue to say that the vaccine is safe. So we plead with the public: the vaccine is safe, but everything you experience, if you experience fever, if you experience injection site pain, if you experience muscle pain, headache, and etc., just call the number there or download the app or go online and report to the FDA, and we'll follow up. We'll collect this data and then submit to our committee, continue to analyze and see if the vaccine continues to be safe in the general public.
Okay. All right, Madam Afutu, you're taking your job tomorrow. Do you have any personal fears?
Oh no, I'll take it right after the program. No fears, because my husband and my children have taken it.
Oh, okay.
Yes, and
all right.
They didn't experience any adverse events after that.
Okay, that's great.
I also take mine. But to conclude, I would like to say that all Ghanaians, citizens of Ghana, should join hands with NCC, the Ghana Health Service, and all health promotion units in the fight against COVID-19.
And finally, with the Ghana Health Service, do you have challenges right now with the vaccinations where we are?
For now, I think that is going well. We don't have obvious challenges. I think as I'm looking at the place,
yes,
I'm seeing people 50 years and above, and so I think it's fine. It's fitting into our segmented population. So we are not trying to exclude the others, but we think that there are people who are more likely to get severe form of the disease. That's why we are putting them as a higher level of segmentation. So we think that we to go like that. We want to also tell Ghanaians that if you look at our dashboard, it appears that the disease burden is improving. But it's happening in the sense that people are actually conforming to the protocols. Before Xmas, we were having about 800 cases as active. When we went for Xmas, it had so many of our friends coming from the UK, the US, and we also decided not to obey any of the protocols. Within a matter of weeks, we went to 8,000. It tells you that the risk of explosion still exists, so that we are safe for the infection. So let's stick to the protocols, wear our mask, wash our hands with soap and running water, maintain the social distancing, and also get vaccinated when it's time.
Okay. Do you expect that if we see any under 30s or 18s, they can be turned away?
No. We don't do that. We don't do that. But as far as we are concerned, we want to make sure that Ghanaians are vaccinated. The aim of the government is 20 million Ghanaians to be vaccinated.
Okay. All right. Well, thank you very much. Gentlemen and lady, I wish you well, the NCC, as you embark on another leg of the campaign tomorrow. Thank you, George, for being here on the FDA's angle, and certainly thank you to you, Dr. Franklin Esiedobekring, who is Director of Public Health at the Ghana Health Service. We'd like to say a big thank you to our partners, Star Ghana Foundation, with funding from UK Aid and FCDO. But this is brought to you by the Multimedia Group. So look out for our series of conversations on the vaccines, the rollout, and the lessons, because obviously there's so much information out there, and sometimes it's difficult to figure out which one is right or wrong. And sometimes when you get the wrong info came to you live from the clinic, we're taking you back to the studio. Benjamin will be ending the show from there. Thanks to the entire production team, our director on the ground as well. See you soon.